symptoms have elevated levels of inflammation.
Your diagnosis there, prophet.
The year 1849. Frederick Pfizer, a businessman and a loving father. He's feeling concerned about his children's future. It's a rough time in Europe. The French army, led by Napoleon, conquers Rome, and the March Revolution is raging in his native Germany. He collects all the money he has and gives it to his son Karl. So that he can cross the ocean and get into a safe, new, and bright world. It is with concern in his heart that Karl obeys his father's will and sets off on a journey with his cousin Charles Erhardt. New York welcomed the guests with a bright demonstration of patriotism and affection to the theater. That time, the city was struggling with disturbance. Thousands of people took part in the riots. Dozens were killed, and hundreds were injured. Why? People were arguing about the best performer in Shakespeare's plays, whether it was the Englishman William Macready or the American Edwin Forrest. It ended with bloodshed when New York gangs joined the dispute. They supported their compatriot as best they could, but solving issues peacefully wasn't their style. The immigrants benefited from these riots. The violence pushed the housing prices a bit down, so the money the brothers received from Pfizer Sr. was enough to buy a small red brick building in Brooklyn. It was there that they also started chemical production. Karl changed his name to Charles, although, as the New Yorker's favorite wrote, "What's in a name? That which we call a rose by any other name would smell as sweet." And the chemist founded the Charles Pfizer and Company. The brothers noticed that New Yorkers loved the theater, but didn't like to wash their hands. Most of the residents suffered from unwelcome tenants, worms. In those days, the remedy for parasites was santonin, which could be found in all types of wormwood, but the medicine tasted pretty bitter. By the way, it was when Erhardt's education came in handy. He was a pastry cook. The brothers mixed santonin with almond toffee, and the New Yorkers loved the new medicine. The company was gaining momentum, and soon the office moved to Lower Manhattan, on Beekman Street. Back then, the district was the center of the chemical and pharmaceutical production of the city. After finding its niche, Pfizer didn't rush to produce something new and compete with the locals. So the neighbors weren't afraid of the German competitor, joking that, "We aren't worms, we aren't scared." But time will show that they should have been on the alert. Resulting from the March Revolution in the 1850s, Germany was undergoing a period of booming economic recovery, so Charles now visited his homeland more and more often. There, he established contacts with suppliers and negotiated supplies of raw materials. On one of these trips to his hometown, Ludwigsburg, Charles met his future wife, Anna Hausch. In 1859, the young people got married. They would have 5 children, 2 of whom, Charles Jr. and Emile, would work for the company. In 1861, the American Civil War began, and Pfizer sided with the North. So, they now had new enemies who they couldn't defeat with santonin. For military needs, the Germans established new production facilities for making iodine, morphine, chloroform, and mercury. No, they didn't poison the Southerners with mercury, but used it for thermometers and photographs. More importantly, the company started producing tartaric acid and tartaric stone, which then were widely used in the food and chemical industries. The acid was used as a laxative and refrigerant, and the stone was a diuretic and disinfectant. These niches would be the most profitable. The war was over, but not forgotten. Thousands of people had mental traumas and needed medicine. In those years, there were no antidepressants, and many used Pfizer's product, morphine. Among those people was Confederate Colonel John Pemberton. The drug was harder and harder to get, and alcohol became an issue as well when Atlanta and Fulton County went dry. The colonel began to look for an alternative. Inspired by Mariani wine made from coca leaves, he removed alcohol and added cola nuts to the recipe as a source of caffeine, thus inventing his own drink. This is how Coca Cola appeared. A drink for abstinence, which many people liked because at that time, the pro-abstinence movement enjoyed wide support. No to alcohol, yes to cocaine. Just to give you some idea, the original recipe included this drug. The soda was positioned as a medicine for many diseases, headaches, indigestion, and of course, the drink helped with morphine addiction and even treated impotence. And since it was a drug, Pfizer was interested. The war showed the Germans that they mustn't focus on a single area. So, when the Americans warmed up to miraculous drinks, the pharmacists contacted the owners of Coca Cola, Dr. Pepper, and Pepsi Cola, and partnered with them, establishing manufacturing facilities for citric acid, which was the basis of these drinks. Imported lemon and lime concentrates were used as raw materials. In no time, the company became the leading manufacturer of this product in the USA. The acid turned into the main source of Pfizer's income and determined the company's growth over the next decades. The company was growing and opened the first branches outside of New York, offices and a warehouse in Chicago. The company was rapidly gaining a leading position in the American chemical industry and supported import and export contacts around the globe. On the 27th of December, 1891, one of the founders of Pfizer, Charles Erhardt, died. He left his share of $250,000 to his son, William. However, the agreement laid down that Charles Pfizer had the right to buy out William Erhardt's share at half its market value, which Pfizer did. But as soon as on the 20th of October, 1906, a modest obituary was printed in the New York Times. Charles Pfizer Sr., who permanently resided in Brooklyn, died last night at his country house in Lingate. A few weeks before his death, Mr. Pfizer broke his arm and suffered other serious injuries, falling down the stairs. He retired in 1900 after the company was corporatized. His son, Charles Pfizer Jr., headed the company, becoming the company's first president. Later, Charles Pfizer Jr. was succeeded by his brother Emil. Mr. Pfizer lived at 295 Washington Avenue, Brooklyn. As for the company corporatization, 20,000 shares with a face value of $100 each were issued, and Emil would head the company until 1941. Pfizer's income multiplied during the First World War. The war needs medicines. The United States remained neutral until 1917, so Pfizer could remain a double dealer. In addition to the capital earned, the priorities also changed. Medicine was now more important than weapons. The war killed tens of millions, but the Spanish flu killed hundreds. The flu was first discovered in the United States and France, but it's known as Spanish because it was there that it was first mentioned in a newspaper free from military censorship. The disease appeared in military camps that accumulated masses of wounded, weakened people in unsanitary conditions and lack of medicines. They were treated with anything, but to be fair, it wasn't that they didn't want to waste resources on soldiers. No one simply knew how to treat. Even bigwigs couldn't get proper treatment, which simply didn't exist at that time. Thus, Brazilian President Rodrigues Alves died of the Spanish flu. Pharmaceutical companies and independent scientists began to look for a medicine. Pfizer's experiments didn't bring them the medicine, but they managed to develop a technology that would make the antibiotic widely available in the future. Chemist James Carey and his assistant Jasper Kane developed a full cycle of citric acid production from sugar to fermentation, which made the company independent of European citrus suppliers. Even more importantly, their deep tank fermentation method would lay the basis for a large-scale penicillin production. Their method would be used to grow the life-saving mold. The most outstanding medical event happened in 1928. Penicillin was discovered, and the world's first antibiotic created. As is often the case, the discovery was accidental. Alexander Fleming was sloppy. His laboratory wasn't just a mess, it was frankly dirty. Returning to the laboratory after a long absence, Fleming noticed that mold fungi appeared on one of the culture samples, and that the Staphylococcus colonies, which had been there, were destroyed, while other colonies were safe and sound. He continued the experiment and found out that bacteria were destroyed by these mold fungi, or rather, the substance they contained, which he would call penicillin. He rushed to share his discovery with the world. Pfizer immediately began experimenting. The problem was that penicillin was hard to isolate in its pure form and in a sufficient quantity. The technology they had developed would come in handy. In the same year, Albert St. Diordi managed to isolate vitamin C. The very vitamin whose deficiency provokes cancer, diabetes, atherosclerosis, blood and liver diseases, and of course, the well-known marine illness, scurvy. And sailors still had long years of sailing ahead. It was only in that year that Charles Kingsford Smith flew over the Pacific Ocean for the first time. The year 28 was full of events. Thanks to the already developed technology of citric acid production, Pfizer could make ascorbic acid without fermentation, which was dozens of times faster than by their competitors. And the product was cheaper. After building a new plant and launching a 24-hour-a-day, 7-day-a-week operating mode, Pfizer became the world leader in vitamin C production. In 1929, the New York Stock Exchange collapsed, and the Great Depression began. But not for Pfizer. For them, it was a golden time, and their income grew. They would soon begin to produce vitamin B2, simultaneously developing complex vitamins that included riboflavin, thiamine, niacin, and iron. By the end of the 40s, the company would become the undisputed world leader in vitamin production. By the beginning of World War II, the American government asked to increase the penicillin production. Pfizer's management invested millions of dollars in new buildings and equipment required for the deep fermentation process. The company bought a freezer unit that could work round the clock. Mold was grown in huge 1,000-liter tanks. As a result, penicillin production was 5 times higher than expected in just 4 months. And Pfizer became the world's largest manufacturer of the antibiotic. Indeed, almost all the penicillin that the Anglo-American troops had when they landed in Normandy was Pfizer-made. After winning the war, Pfizer gained new markets in Brazil, Cuba, Mexico, Europe, and Turkey. The company started to buy up competitors. And the first purchases included J.B. Rohrig & Company and the German Mac-Alertison Company. As time went by, Pfizer's appetite kept growing. And soon, the company would become famous for the largest deals in the pharmaceutical industry. Here are just a few of them. Medivation Inc. for $14 billion, Wyeth for $68 billion, and Warner Lambert for $93 billion. In the 70s, the research budget grew from 5 to 20% of sales. The company successfully developed and registered such medicines as Feldin, Glucotrope, Procardia, and many others. The company would make its first billion from selling piroxicam, a drug for treating the musculoskeletal system diseases, but it would get its real profit in the 90s. When Pfizer was developing a medicine to reduce blood pressure, they noticed a side effect. When the pressure dropped, something else went up. Vigor, a power, and Niagara, a waterfall. Viagra became a money waterfall for Pfizer. Over the next few weeks alone, doctors prescribed Viagra more than 40,000 times. After a few months, the revenue from selling small blue pills amounted to $400 million, and soon to more than $2 billion a year. The new medicine became so popular that the former Pfizer employee Jamie Reedy would write a book called Hard Sell, The Evolution of a Viagra Salesman, in which he would reveal the secrets of the pharmaceutical industry, describe pharmaceutical companies and their sales agents' dubious working methods, stating that the pills prescribed by a doctor don't always depend on your illness, but often on a sales representative's short skirt. He also mentioned human experimentation, Speaking of which, the Nigerian authorities accuse Pfizer of illegal experiments on children. Nigerian authorities accuse Pfizer of illegal experiments on children. During the meningitis epidemic that broke out in Nigeria in 1996, Pfizer tested a new antibiotic, Trovin, in Kano State. About 200 children suffered from these experiments. 11 died. The rest became disabled, blind, deaf, or paralyzed. Nigeria filed a billion-dollar lawsuit, but Pfizer didn't admit its guilt, claiming that the local government permitted the experiments and the nurses who injected the medicine warned parents that it was an experimental one. It's interesting that the subject of the dispute isn't the experiments themselves, but their unapproved nature. A lawyer of 30 plaintiffs' families, Elaine Kusel, said that Pfizer hadn't been given the right to experiment. They, the researchers, just selected children from a number of families waiting for help outside the hospital. They didn't have any permits. They also didn't inform parents that their children could be treated with ceftriaxone in hospitals. As a result, after 13 years of disputes, Pfizer agreed to pay $75 million to Nigeria, of which $35 will be paid to the victims' families, $175,000 per family, and the rest will be allocated to the Nigerian health funds in exchange for dropping the charges. In their statements, the parents claimed that they were tired and just wanted money, so everyone agreed to drop the charges, and the case was closed. However, it was only in 2011 that the information that the money reached the parents appeared, and it related to 4 families only. It's unknown for certain whether the money reached the rest. However, Pfizer lost more than $75 million. After experimenting on African children, they planned to sell the medicine in Europe, but the European Commission revoked the license for Trovin. In 2009, the New York Times published an article with a catchy headline, "The biggest healthcare fraud and the highest criminal fine in history." Pfizer was accused of illegally selling the revoked painkiller Bextra and was ordered to pay a fine of $2 billion. This was unexpected because there had been cases of selling unlicensed medicines before. However, the problems were solved at higher levels. But it looked like Jeff Kindler, the company's CEO at the time, lost his negotiating skills and was replaced by Ian Reid after the scandal. Under him, the company managed to lobby for its interests. Just to give you some idea, Pfizer was the 6th in Washington in terms of lobbying activities, spending millions of dollars on healthcare reforms. Of course, it had to launder the reputation after the scandal, and the Nigerian story came in handy. As it's been mentioned before, the company not only paid compensation to the victims' families, but also financed charity funds, and everyone seemed to be satisfied. Despite the scandals and its popular Viagra, Pfizer became really popular after the coronavirus epidemic. As a reminder, Pfizer is a leading producer of vaccines. Since 2020, their revenue doubled compared to 2021, reaching $80 billion. Pfizer accounts for 70% of the COVID-19 vaccines supplied to the United States and the European Union. And of course, it couldn't come without a scandal. Former Pfizer Vice President Michael Yedin and other employees talked about the global conspiracy of pharmaceutical companies. We're in the epicenter of a crime being committed. Any drug must be sold. And to sell it, you need scared people who are eager to buy this drug. This story is as old as time. At first, they scare or produce an appearance of a problem, and then they offer to solve this problem with a pill. Unfortunately, inconsideration or working from morning till night prevents a person from getting to the bottom of it. The former vice president said even more interesting things, but he didn't provide any evidence. He believes that no one needed the vaccines, supporting it by the fact that the EU countries destroyed coronavirus vaccines worth a total of 4 billion euros. After they failed to sell them to third world countries, they simply didn't need them themselves, which was very suspicious, since they bought the medicine back in 2021, when the pandemic was in full swing, and demand for vaccines exceeded supply. According to the press, the vaccines were lying in landfills all over the continent. And of course, the largest supply contracts for vaccines were signed with Pfizer. Amid the conspiracy theories and distrust of pharmaceutical companies, it was reported at the end of 2023 that Pfizer was expecting a turbo cancer pandemic, for which they bought Seagen, a company researching the new disease. But this wasn't the case. Pfizer did really buy Seagen for $43 billion, and Seagen is really a company producing drugs for cancer, but not for a fictional disease. There is no turbo cancer. It was invented by Charles Hoff, a doctor from Canada. He believes that this type of cancer develops after the vaccination with the anti-COVID-19 mRNA vaccine. So far, there's been no scientific research that can confirm that the Canadian doctor's right. No case of turbo cancer has so far been confirmed in the world. Let's acknowledge the obvious. Corporations like Pfizer are engines of progress. It is they who, investing billions in research, give us medicines and technologies that save millions of lives. But their history also reveals a frightening truth. The colossal power capable of defeating disease can just as easily blur the boundaries of ethics. Under pressure from lobbyists, laws are weakened. Under the influence of grants, research becomes biased. And in the pursuit of clicks, the media loses its objectivity. And then the last force comes to the fore: civil society. You and me. It is we, the consumers, patients, and voters, who have the power to demand transparency and punish with our money or our votes. But are we ready for this responsibility? Are we, divided and vulnerable to manipulation, capable of uniting and creating a system of public control that no corporation can buy or intimidate? Ultimately, the battle for our health and future is not being fought in boardrooms, but in the minds of each and every one of us.